Hi everyone, welcome to Rethink, Your Life, Your Choice. We bring community leaders, advocates, and residents like you together to find solutions for better health where we live, work, learn, and play. I'm your host, Emily Deeringer. Thanks for joining us today. There's been a lot of focus around mental health recently, not just in our area, but across the country. So that's what we're going to be talking about today. In Winnebago County and the Fox Valley, we're dealing with some really high rates of suicide, especially for teens and middle-aged men, as well as high rates of adverse childhood experiences like abuse, parental substance abuse, and mental illness, and trauma. We'll get into a little bit more about all of those things later today. But mental health awareness is gaining momentum and starting to get some of the attention it deserves. Today we're sharing some of the work being done in area high schools to improve emotional wellness, as well as showcasing the Northeast Wisconsin Mental Health Connection. And all of those groups are doing a lot of great work to improve the mental health care system in the Tri-County area. So I'd like to welcome our first guests today. We've got host Angela Berbert, Executive Director and Counselor with the Samaritan Counseling Center of the Fox Valley. Welcome.
Thank you.
We have Jen Parsons, Wellness Screen Program Coordinator for Samaritan Counseling.
Thanks.
And Matt Kemmer, Director of Pupil Services for the Oshkosh Area School District. Thank you all for being here today.
Thank you.
So, Angela, can you tell me a little bit more about Samaritan Counseling, kind of what you do over there and kind of where it started?
Yeah, Samaritan Counseling Center has been around since 1970. We changed names along the time, but that's how we are known right now. Our main office is in Menasha, and we have locations here in Oshkosh, New London, Kaukauna, and we serve also the Living Healthy Community Clinic population, and we serve the students at UW Fox Valley. Our services to the community, they are based on, I like to say, in three pillars. One is counseling that integrates the client's spirituality, not religion, not any denomination, but the spirituality. The second pillar is the care for ministers and their faith communities of any denomination to provide base for the work with mental health, people with mental health issues. And the third pillar is in the direction of suicide prevention, and the biggest piece of that is the wellness screen program, and we also support QPR trainings in the area.
Great. So one of the things we're talking about today specifically is that wellness screen. So can you tell me a little bit how that got started in this area?
Yes. Around 2009, there was a large number of suicides in the Kaukauna area. And at that point, a group of members of the community got together to tackle that problem. And they formed an organization called Connected Communities. The new mental health connection that we're going to learn more in the next segment was very important in coalescing that group. One of the things that they identified at that point was that it could be very helpful to begin to screen for potential risks of suicide and intense mental health issues amongst high schoolers. And that's how the Wellness Screen program started. At that point, it started with the name Connected Community Teen Screen.
Okay.
And then in 2014, it changed to Connected Community Wellness Screen.
Gotcha. And mental health is a part of overall health and wellness, so I think that makes a lot of sense.
Yes,
So.
we started our first school pilot in Kaukauna in 2012, 2012 indeed. And then we spread this throughout the valley now.
Right, and I know we've got several schools here in Winnebago County that are doing the wellness screen. So Jen, can you tell us a little bit about how that wellness screen process looks like in the schools and for the students?
Yeah, as the coordinator of the program, I oversee kind of the structure and the function of the process and the screening within the school districts. And how the screening process works is a parent and student have to give consent to screening. We come into the schools to offer the screening. The students take that screening through a computer. We get the results, we debrief them on the answers that they've given us. And then after they get debriefed, some of those students also go through a clinical interview process with one of our clinicians. And then at that point, we assess the suicide risk along with other things that the questionnaire will pick up: anxiety, feelings of low mood, and things like that. And we assess that risk with that clinical interview and then contact the parent and make sure that there's kind of that further evaluation on that mental health concern that comes up in the screening process.
So speaking of that, what are some of the common concerns that the wellness screen might catch in students? I know you said anxiety was one of them.
Some of those examples would be, and parents can even look for some of these things too, would be stressors, whether it's from school or peer pressure, some of those stressors that really impair the daily activities. Also the depressive feelings like low mood, and also anxiety, feelings of worry. Some of those things that start to impair those normal activities are things that we really look for.
Mm-hmm.
We also talk a lot about, within the questionnaire and debriefing, about the level of stress that those students are under and if they're able to cope with those. So we talk about coping skills a lot with them.
Awesome.
Too.
Those are some. Anybody else want to add anything?
Yeah, when we identify students who have already been utilizing maladaptive coping skills, such as substance abuse or even self-injury, we try to address that as best as we can with their consent. We talk to the parents about their substance abuse and make referrals in that. And in case of self-injury, that's certainly a self-referral for further evaluation. And there are cases when the students full out tell us that they are indeed thinking suicide, and then it's emergency line, and then getting them connected immediately.
Right. Well, it sounds like a really important screening tool to have school partners is crucial, because we're our kids, we're our teenagers, they're in school, so most of the time. So so Matt, as People Services Director, can you tell us a little bit how the wellness screen has been going in Oshkosh?
It's been going really well. We saw a dramatic rise in participation from year 1 to year 2, which is a great sign. So it just means more and more students are being screened and identified for services for those that need it. The district itself has seen a great deal of value in the screening. We do a lot to educate not only our staff but our students on signs and symptoms of mental illness and where to go for help if they recognize those signs and symptoms in others. So the place they go is usually to our counselors, our social workers, our school psychologists, and they also do a wonderful job of steering students in the direction of the supports that they need. But inevitably there are going to be students that we miss, and that's where the wellness screen picks up. And even if it picks up one student that we wouldn't have reached without it, it's well worth the investment in my mind.
Yeah, that's great. And as a a school, a lot of times our schools are tapped for so many different things that it can feel a little overwhelming. I'm like, now this community group wants us to do this thing. But I applaud Oshkosh, all our schools, our local schools, for really taking this on as a role for your school, as a way to help your students.
Yes, and the hope is that as we continue to build our mental health framework as a district, that this is something that only grows from here on out.
Awesome. So it sounds like, from what you've all said, this is such an important touch point in a student's life for so many reasons. So is there anything that parents or caregivers, if they have a concern about their child, what could they do about if they're concerned about their child's mental wellness?
Well, I think the first thing is if the schools are not in session and they cannot access a school counselor immediately, they should talk to a primary care physician, and ask the questions and get that first evaluation right there. And then look for the resources that we do have in the community for mental health for children. 211 from United Way is a great resource to get people the information they need about the resources available. But during the school year, I would say a first touch with a school counselor or a school social worker is a great resource. And then for high school students, to make sure that they get information about the wellness screening.
Yeah. And, I know in Winnebago County we're in Oshkosh and Amro, right?
Yeah.
So if your student is in one of those schools, when school's in session, look for that wellness screen.
Yes, look for that wellness screen and reach out. I think, the school staff, especially within the Oshkosh School District and Amro, and we're expanding throughout Winnebago County, but I think the school staff want to be as involved as we do in providing the service, and so if that's the first contact, they can even refer them to us for additional help with getting those resources. But also, if they are a part of that school district, we are in there during the school year to come and take the wellness screen and get their students signed up. And if they're not within the school districts that are offering it, contact me. Feel free to reach out, because we can accommodate for students that aren't within a school district that
Awesome.
would like to be screened.
Thank you. Great. Well, thank you so much all for being here today and sharing about this super resource that we've got in our high schools right now. So really appreciate all the work that you're doing on mental health. So
Thank you.
Thank you.
Thank you for the opportunity.
You're welcome.